The Thyroid Immunity Connection. Insights from Dr. Broda Barnes. Dr. Broda Barnes was a pioneer in thyroid research. He observed a fascinating link between hypothyroidism and immunity. He found that individuals with low thyroid function were more susceptible to infections. This observation sparked his interest in the complex relationship between thyroid hormones and the immune system. Dr. Barnes's work laid the foundation for further investigation into how thyroid hormone levels impact immune responses. He proposed that thyroid hormones play a critical role in maintaining a robust immune system. His findings suggested that even slight dips in thyroid function could compromise the body's ability to fight off infections. Dr. Barnes's observations, though intriguing, were based on clinical experience rather than controlled studies. However, his work served as a catalyst for future research that would delve deeper into the mechanisms by which thyroid hormones influence immunity. His insights opened up a new avenue of exploration in the field of endocrinology and immunology. Hypothyroidism and infections, lessons from mice. In 2014, Dr. Cristiana Parada and her team conducted a groundbreaking study on mice. They wanted to understand how hypothyroidism affects the body's response to infections. They induced hypothyroidism in a group of mice and then exposed them to a common bacterial infection. The results were striking. The hypothyroid mice were far more susceptible to the infection than the mice with normal thyroid function. They developed more severe symptoms and had a harder time clearing the infection. The study provided compelling evidence that thyroid hormones are essential for mounting an effective immune response. The study's findings have significant implications for humans. They suggest that individuals with hypothyroidism might be at an increased risk of infections. This highlights the importance of diagnosing and treating hypothyroidism appropriately to maintain a healthy immune system. Stress, lymphoma, and thyroid hormones' protective role. Dr. Luciana Frick in 2009 investigated the link between stress, lymphoma, and thyroid hormones. She subjected mice to chronic stress, a known risk factor for lymphoma development. Interestingly, she found that mice with normal thyroid function were less likely to develop lymphoma compared to hypothyroid mice. This study unveiled a potential protective role of thyroid hormone against lymphoma. It suggested that thyroid hormones might help mitigate the negative effects of stress on the immune system. The study's findings added another layer of complexity to the understanding of thyroid hormones' influence on cancer development. Dr. Frick's research opens up exciting possibilities for future studies. If thyroid hormones indeed possess protective properties against lymphoma, it could pave the way for novel therapeutic approaches utilizing thyroid hormone replacement or analogs. Section 4. Boosting anti-tumor immunity, the power of T3. Dr. V.A. Alamino and Dr. Ilan Krashen have been studying the effects of T3, a type of thyroid hormone, on the immune system. Their research has revealed that T3 can enhance the activity of certain immune cells. These cells, known as natural killer cells, play a crucial role in identifying and destroying cancer cells. Their findings suggest that T3 can bolster the body's natural anti-tumor immunity. This discovery has significant implications for cancer treatment. It raises the possibility of using T3 as an adjuvant therapy to enhance the effectiveness of conventional cancer treatments like chemotherapy and radiation. While promising, more research is needed to determine the optimal dosage and long-term effects of T3 supplementation in cancer patients. Nevertheless, these findings highlight the potential of harnessing the power of T3 to boost the body's natural defenses against cancer. Section 5. The double-edged sword, thyroid hormone as a cancer promoter. While some studies point towards the protective effects of thyroid hormones against cancer, others present a more complex picture. Research has shown that thyroid hormones, particularly T4, can also promote the growth of certain cancer cells. This dual role of thyroid hormones in cancer development has puzzled scientists for years. The mechanisms by which thyroid hormones promote cancer cell growth are still being investigated. Some studies suggest that thyroid hormones might stimulate the proliferation of cancer cells by binding to specific receptors on their surface. This binding can trigger a cascade of signals that ultimately lead to uncontrolled cell growth. The dual nature of thyroid hormones in cancer necessitates a cautious approach. While thyroid hormone supplementation might be beneficial in certain cases, it could be detrimental in others. Further research is crucial to identify individuals who would benefit from thyroid hormone therapy and those who might be at risk. Section 6. Medical hypothyroidism, a potential weapon against cancer. The concept of using medically induced hypothyroidism as a cancer treatment might seem counterintuitive. However, research by Dr. Asher Fabian and Dr. Herkbergs suggests that it might be a viable option for certain types of cancer. Their studies have shown that depriving cancer cells of thyroid hormones can slow down their growth and even induce cell death. This approach, known as thyroid hormone deprivation therapy, is based on the premise that some cancer cells are dependent on thyroid hormones for survival. By lowering thyroid hormone levels in the body, this therapy aims to starve cancer cells and inhibit their growth. While promising, thyroid hormone deprivation therapy is still in its early stages. More research is needed to determine its long-term efficacy and safety. However, it represents a novel approach to cancer treatment that could potentially benefit patients who don't